Justine Tangakeya Basekauke's husband was killed by an angry mob that believed he was linked to the spread of a fake illness. John Tangakeya was a healthcare worker in northeastern Democratic Republic of Congo. Rumors had rippled through villages in the region claiming a disease caused men's genitals to atrophy, triggering a very real panic that turned deadly before the government could react, and highlighting the dangers of online health misinformation in Africa. 4 health workers doing unrelated vaccine research were killed, incorrectly accused of secretly spreading the sickness, 4 officials and a survivor told Reuters. At least 17 deaths have been linked to this single rumor, according to the WHO-led Africa Infodemic Response Alliance, or IRA, which monitors fake health information. Reuters could not independently verify all of the deaths. Reuters examined medical studies and over a dozen video testimonials for this story, like this one, with hundreds of thousands of views. In it, a man on stage in a church claims, without evidence, that he suffered from the fake illness and that his pastor cured him through prayer. It was posted on TikTok by a church employee. So how does a rumor with no medical evidence end up causing violence and death? A lack of faith in established medicine exists across the world. In parts of Africa, it's somewhat rooted in the colonial era and more recent Western clinical trials. And patchy healthcare access and a weak rule of law can help rumors to spread. Things are made worse by social media and cheap artificial intelligence, says the African Union's Africa Centers for Disease Control and Prevention.
Misinformation in the public health area kills, erodes trust, and even is used by some people or some groups to mislead communities. Why am I saying it kills? Because the mistrust that we are putting, population not trusting vaccine, not trusting health workers, not trusting government policies, it means these people, they don't have access to services that can help them.
At the time of the attacks, local officials investigated claims by 5 people who said they had the disease. They found no evidence of genital atrophy. The day after the killings, the Kisangani governor's office put out statements saying the rumors were false and dangerous. But how do you fight something that spreads this fast? In DRC, Bavon Tangunza's job is to track what people are saying online before it spirals.
Quand il publie, nous regardons tous les commentaires. C'est dans les commentaires qu'on sait savoir ce que pensent les gens, ce que disent les gens, et ainsi de suite. En dehors de ça, nous faisons l'écoute sociale en ligne. À travers les mots-clés, nous allons sur Facebook, sur X pour voir les sujets qui nous préoccupent.
After the October killings, Bavon helped craft warning messages broadcast in local languages and through community workers. A local court sentenced a man who accused another of spreading the disease to 12 months in prison. But the rumors keep coming back. In March, a woman was accused of spreading the disease and lynched, IRA said. The problem of misinformation in Africa is widespread. A WHO-run hotline set up in late 2024 saw calls surge from just over 3,000 to more than 31,000 in under a year.
We need to understand the root cause or all root causes of actions that people are conducting. If you don't understand the root cause, you cannot address the issue.